This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, November 4th, and I'm Zach Caruso. Our lead story this week is in Health Affairs and is titled States with Substantial Increases in Buprenorphine Uptake Did So with Increased Medicaid Prescribing, 2018 to 2024. Multiple federal policy changes since 2018 intended to increase buprenorphine prescribing in response to a persistent treatment gap for opioid use disorder in the U.S. Anticipated national increases did not occur, but highly variable state-level trends provide important insights. The study used IQVIA data to examine all payer and per-payer prescribing across states during the period 2018 to 2024. Researchers found that highly disparate state-level changes suggest that federal policy impacts were mediated by state-specific factors. Medicaid's key role in driving overall prescribing highlights the public health urgency of maintaining expansions and sustaining enrollment for the single adult population. Next is an article in Drug and Alcohol Dependence titled Extreme Vulnerability to Overdose Mortality, Intersections of Detailed Race/Ethnicity, Educational Attainment, Age, Sex, and Nativity. This is a cross-sectional analysis of 512,000 drug overdose deaths based on U.S. death certificate data from 2018 to 2023. Authors calculated drug overdose mortality rates as well as proportionate mortality for different subpopulations. The study found that male Puerto Rican Americans between the ages of 35 and 49 with a high school education or lower experienced the highest drug overdose mortality rate at 261.9 per 100,000 and the highest overdose proportionate mortality. Following this group, male U.S.-born non-Hispanic American Indian/Alaska Native Americans ages 35 to 49 with a high school education or lower had an overdose mortality rate of 235.2 per 100,000. The study highlights that while overall overdose mortality has improved, certain populations continue to experience disproportionate rates of fatal overdoses. Our next article is in JAMA Psychiatry and is titled Stimulant Use Disorder Diagnoses in Adolescent and Young Adult Medicaid Enrollees. This cross-sectional study of national Medicaid data from 2001 to 2020 examined if the proportion of young people diagnosed with cocaine or non-cocaine psychostimulant use disorder increased from 2001 to 2020. The proportion of young adults aged 18 to 29 diagnosed with non-cocaine psychostimulant use disorder increased from 0.10% in 2001 to 0.91% in 2020. Trends were more stable for adolescents aged 13 to 17 and for cocaine use disorder. Comorbid mental health and substance use disorders were common in patients with stimulant use disorder. The increase in non-cocaine psychostimulant use disorder diagnoses may be due to changes in availability, use, or misuse of prescription and illicit stimulants along with increased clinical detection. Next is an article in the Journal of General Internal Medicine and is titled Impact of Substance Use Navigators on Initiation of Treatment for Substance Use Disorders and 30-Day Unplanned Readmission. At least 12% of hospitalized patients have a substance use disorder but infrequently receive evidence-based treatment. Researchers conducted a retrospective cohort study in a rural hospital to evaluate the impact of a substance use navigator or SUN on receipt of medication of opioid use disorder, receipt of medication for alcohol use disorder, and 30-day unplanned readmission. Initiation of MOUD/MAUD was higher among those who received a SUN consult than those who did not. In addition, 30-day unplanned readmission rates were lower in the SUN group. Authors note these findings support hospital-based interventions, and this program may be a model for other hospitals, particularly rural hospitals that don't have addiction consult services. Our next article is in Health Services Research and is titled State Proposed Strategies to Expand Access to Medications for Opioid Use Disorder. MOUD is underused, and researchers evaluated how several states tried to address these issues under Center for Medicaid and Medicare waivers. States identified 6 main barriers. 1. Lack of MOUD providing facilities. 2. Care transition. 3. Care coordination. 4. MOUD access in residential facilities. 5. Prescriber shortages. And 6. Delays in care. Proposed strategies to address these issues included removing prior authorization requirements, instituting requirements for residential facilities to provide MOUD, and clinics to provide care coordination. Other proposals increase reimbursement to try to increase care coordination services and increase the number of providers. Education and training strategies were also proposed. While additional research is needed to evaluate the impact, authors suggest other states could adopt these strategies. Next is an article in the Journal of Addiction Medicine and is titled Methylphenidate for the Treatment of Cocaine Use Disorder, a Systematic Review and Meta-Analysis. The incidence of cocaine use disorder, or CUD, in adults with ADHD is around 10%. This study reviewed the evidence for methylphenidate, or MPH, as treatment for CUD. 20 studies met inclusion criteria for the systematic review, and 6 of these were randomized controlled trials used for the meta-analysis. Craving for cocaine was increased by intravenous MPH, while oral MPH reduced craving in some studies with no change in others. Meta-analysis showed no effect on craving but only included 2 studies. 4 studies measured cocaine use, and meta-analysis showed no effect of MPH on cocaine use. Most of these studies did not consider ADHD, and those that did showed mixed results. Authors felt that the limited number of studies left evidence for MPH in CUD inconclusive, but felt further research in patients with CUD and ADHD is needed. Our next article is in BMC Public Health and is titled Gas Station Heroin Tianeptine and Its Impact, a Systematic Review and Exploratory Analysis. Tianeptine is a novel tricyclic antidepressant that acts as a full agonist on the mu opioid receptor. Although not approved for medical use, it can be purchased online and in gas stations in the United States, hence the nickname Gas Station Heroin. This is a systematic review focused on tianeptine misuse, including demographic and regional variations, clinical outcomes, dosage, route of administration, and treatment strategies. 25 total case reports from North America, Asia, and Europe were included. Published reports found that oral ingestion was most common, followed by intravenous use, with a significant association between oral ingestion and overdose. Dosage and frequency of tianeptine use varied widely, as well as co-administration with other substances. 7 of the cases resulted in death. Our final article is in the British Journal of Surgery and is titled Alcohol Use Disorder and Alcohol-Related Mortality After Metabolic Bariatric Surgery, Prospective Controlled Cohort Study. This study included patients who had had bariatric surgery in Sweden between 1987 and 2001. Information about AUD diagnosis and alcohol-related mortality during follow-up came from the Swedish National Patient Register. Surgical patients were compared to a matched control group of patients with obesity treated without surgery. The risk of AUD diagnosis was elevated after surgery. Gastric bypass or GBP hazard ratio was 5.1, gastric bending or GB hazard ratio was 2.3, and vertical banded gastroplasty or VBG hazard ratio was 2.3. Alcohol-related mortality was also increased. GBP hazard ratio was 6.2, and VBG hazard ratio was 3.6. These results were statistically significant. However, alcohol-related mortality after GB with a hazard ratio of 2.5 was not statistically significant. AUD diagnosis and alcohol-related mortality are increased after bariatric surgery, with the greatest risk after GBP. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.